GW Office of Integrative Medicine and Health. Welcome to a mindfulness experience. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. The GW Office of Integrative Medicine and Health promotes integrative medicine by providing learning opportunities to health professionals and healthcare consumers. Today's facilitators are Dr. Lee Frame, it's a surprise guest there, and Pilar Segura Little, a certified yoga teacher who has been practicing yoga and meditation for over 15 years. So I will hand it over to you, Dr. Frame.
Thank you, Tatiana. So we'll keep this really relaxed and informal, but I have been thinking a lot about one topic, so I think it works out nicely that I'm here and I will talk about it. And that topic is nutritious movement. If any of you have heard of Katie Bowman, you've heard of the terminology nutritious movement, but I think it's a really helpful concept, particularly for those of you who now have some familiarity with nutrition. And the concept is that there are so many different aspects of movement in our world that we need to think of them more like we think about nutrition. So each type of movement is like a vitamin or a nutrient. And if we don't get all the different types of movement, then we're not getting all the different nutrients that our body needs. So most people typically get 3 different nutrients, if you will: run, walk, sit, and stand. And I'm sure most of you, that's all you've done today is those 3 things, because that's what fits in our regular day. But if that was akin to a nutrient, then you were only getting 3. So it'd be like getting A, C, and D and not getting any of the others. You could see where that would be an issue. And another way of thinking about it is that you really need to move every aspect of your body in every way that it can to keep it moving, keeping it flexible, keeping it able to do that. Motion is lotion, that concept, right? Use it or lose it. And how do we do that throughout the day, particularly if we're sitting, standing, maybe walking, running, and spreading that out throughout the day? So I would love to actually interact with you all and see what you do to break up your day. Maybe what you do after this. You sit with us for an hour, most likely. What do you get up and do afterwards to kind of like get your body moving and get some of that nutritious movement? Anyone have any thoughts?
I have a thought. I don't have my hand up though, but
go ahead, Sheila.
One of the things I try to do, I don't have a lot of intentional, like an exercise routine, but when I go out now, like I'll park, far out in the parking lot to walk up to the store. And sometimes I'll even, if it's on a strip mall or a mall thing, I'll walk up and down that thing before I go into the store. And if I go to the grocery store, I will walk around, this is almost like a track in a grocery store. I have my little cart and I'll walk around about 3 times before I get my stuff. So I try to kind of incorporate more movement in regular activities where I would just be getting something and just leaving, and determine before I get there that I have time to do movement. Mm-hmm. So and incorporating something in your errands and things like that.
And so that's just part of your routine now. Whenever you do it, you're going out and you're doing it that way.
Exactly.
Excellent. It's a good, healthy habit. I like that one. I think Nadia was going to say something.
Yes. I enjoy doing yoga, and that feels good. And then I still take a ballet class once a week, and that is really a lot of fun. I've been doing it for almost 40 years.
That's fantastic. I think you brought up 2 important points there. Finding something you enjoy. So you love doing yoga and ballet, but also finding something that's really fun. And I think a lot of times we think about physical activity, we think about exercise, and we think about having to go to the gym or having to do an exercise class. And it's like it's a chore. It's something we have to do to be healthy. And I don't think that needs to be the case. We can find something that we're enjoying and hopefully getting something else out of it, right? Like something in terms of our mind body, or something in terms of our soul and just making us feel happy and enjoying. It sounds that's what you're doing with both of those, Nadia.
Absolutely. I miss it if I can't do it.
Yes, I am the same way. I was actually on vacation for a couple of days for my husband's birthday, and I missed my regular yoga, and I could not wait to come back and do it. I actually felt it. I felt like my body was stiff, and I missed just getting in there and moving around. So the first day back was both wonderful and also a little bit rough, because I was a little bit stiff from mostly sitting on the train and then just walking around and not doing much of anything else. Anyone else have any comments?
Well, sorry. Hi, this is Salam. I have like 6 exercise classes a week. One of them is Tai Chi, and in between, I walk. So
Very good.
If I don't do it for 2 weeks, I'm not in good spirit.
Yeah, that's very good. And a lot of the things that we've done on here related to like Tai Chi or Qigong are really great things you can do kind of throughout the day. Like, you just feel a little tight, just do a quick little, breathing exercise, getting your arms up, just getting them moving. That can be fantastic. The recommendation is actually to move every 20 to 30 minutes. But you think about if you're sitting down with us for an hour, or you're sitting down and watching a TV show for an hour, that means you should move like 2 or 3 times during that period. So it used to be we had commercial breaks, and I would always get up during the commercial breaks and stretch or walk around and do things like that. We don't have those indicators as much anymore because everyone's watching Netflix and streaming. But I think we still need to be mindful that we need to move every 20 to 30 minutes. It doesn't have to be a lot of movement, but just taking that break and doing something physically active. And it doesn't have to make you sweat either, right? It could just be, reaching up really high and stretching your hands, very simple things that keeps your body moving and getting those different types of movement, which I'm also hearing from you, Salome, that you're walking and you're doing Tai Chi. And Tai Chi has a lot of great different movements in it. So yoga, you're getting a lot of different kinds of movements from that. So a very nourishing movement. Any other?
As you know, whoops, sorry, am I getting a lot of feedback? As you know, I run a karate school. And so I have 3 classes a week, but within karate, we have kata, and kata are a series of patterns and movements. And I guess it's like Japanese line dancing. But it also has a series of slow and fast movements. And then also at work, we have the music playing, and every now and then I just get a bit of a groove on, and just small movements through the day. And that's something that I share with my patients too, is that, you can make movement, just any additional movement over and above what you're doing. And whether you're sitting, standing, or walking, you can still get your groove on.
Yes, I love that. And I think spontaneous dance needs to be more a part of our life for lots of reasons. It's fun, you're getting physical activity, your mood is lightening. There's so many great things coming from that. And I was giving a talk the other week about how our society has kind of bred the play out of us. As children, the idea of just breaking out into dance, it seems totally normal, right? You wouldn't even hesitate. You would just start dancing and you'd have fun. But as adults, we've been taught to like compartmentalize things and say, this is not an appropriate place to be dancing, or this is not an appropriate time to be moving, right? I have to sit here and be still because I'm in a Zoom meeting. And that's not necessarily true, and it's not necessarily good for us. So I think just trying to channel more of your inner child and enjoying life, good for so many reasons, but also good in terms of getting that nutritious movement, because children move all day, right? They don't stop moving, and that's their natural state. It's not until they get to school and they're told to sit in their desk for hours at a time that they really start to conform to this idea of now is not an appropriate time for movement. And related to that, I also personally have a lot of inspiration from my pets that I've had over my lifetime, dogs and cats. Cats are really fantastic in terms of stretching, right? Every time they get up, they stretch every single time. It's just a natural part of their life. And I think that can be a really good inspiration for us too. especially if you can make it a habit. So it's something you're doing every time you get up from the couch. You take a brief 1 minute stretch, get your body moving, and then walk and do whatever you're doing. Building that habit's the hard part though. So I know that's the part we're all working on, is trying to get these things into our life and making them habits. And sometimes we're successful, other times we're not. But I think as long as we keep trying and being creative and not being hard on ourselves when it doesn't work, then that's really all that matters. Like, we're trying, we're getting out there, we're trying to move our bodies, and that will move us in the right direction. Oh, I do see Dr. Kogan has joined us. I'm sure.
Sorry, everybody. It was pretty enlightening conversation at the American Geriatric Society on use of supplements in older adults. I couldn't disappear out of that quickly.
Yeah, that's a good one.
Yeah, their lesson was a little better than usual. There's been a 30% increase in use of supplements in older adults in the last 10 years, 30%. So it was about 40, now it's 67. They don't quite understand why that's happening. They think that because the message, general public messages, they don't work for anything, stop using. And so the presenter went into very deep detail on why they think it's actually happening and some really good points. For example, actually evidence for certain vitamins is very strong. And I actually really like the presentation that centered around just a few core supplements, and some of them may not be very well known, like MSM, for example. With really good data on pain. Some articles I didn't even know, so I'm sorry, I totally lost track of time. You get passionate about something and that happens. So anyway.
I'm sure we will benefit from that research in the near future.
Oh yeah, and I'm not gonna take a lot of time. I wanted to give just a couple of very quick updates. One is very positive. I think everybody have seen the updates on US data that we are in a very good position. We are rapidly decreasing number of new cases, and number of deaths has been the lowest since over 6 months. There's not a single state that's seeing an increase. So this is a pretty new update. The second is actually not necessarily related to any of us personally on this phone call, on this Zoom. It's a use of vaccines in pediatric population. I felt like, I'm sure many of you are like asking this, and in anticipation of this, I thought long and hard, and in contrast to my strong position on all adults should get the vaccine here, I'm actually going to say something non-expected. I actually am not in agreement currently with the CDC guideline. I feel strongly that data is not there. I feel strongly that as a parent, risk for my kids of getting sick is extremely low, meaning that even if they do get sick, they're not going to get complications. It's currently less than 1% of all illnesses in kids 12 to 14, and a very small proportion of those kids get really sick. So we're basically doing this for public health good. And as a parent, I would like to see a lot more data on the trajectory of illness overall, and on the actual pragmatic need for kids to be vaccinated in this age group to protect the rest of population. I have not seen any senior leadership bringing this up and discussing it. I've only seen a general CDC guideline. I have not seen Anthony Fauci stand up and give a reasonably strong opinion and clear conversation. I have not seen any other organizations yet making their statements based on what I just mentioned. And I dislike the fact that all of this is extremely rushed. Yes, sure, vaccine is 100% protective, but the amount of side effect discussion in the Pfizer study on which CDC based their recommendation has been minimal. Long side effects have not been discussed at all, as if they're not going to exist, which we don't know. So in short, I cannot give you any helpful advice. And as an adult, as a parent of 2 boys, for now, I am not having them vaccinated, period. If things change, we're gonna see. But as a parent, I cannot. But I have completely 2 healthy kids with a strong immune system who've been taking vitamin D, zinc, and multivitamins. I feel that if they get sick, it's going to be very mild. And currently, until I know more data, I am not willing to put their health in possible long-term jeopardy based on the fact that that may be protecting some of the. So I'm open to change my opinion in the weeks to come, but for now, this is where I am. That's it. I think that's my entire update. And I see that there are questions. And I understand that this may not be in agreement with even the leadership of my own university. And that's okay, because I am not saying do not vaccinate either. All I'm saying, I want more experts come out and provide reasoning here and explain the data. I could not carefully decipher the study. The publication that I read was very superficially put together and just didn't really want it to even discuss certain side effects that they have seen, which I find a little strange. It felt like they're just simply running through quickly to get the CDC approval. And I think that's misguided because, you know, they're currently, as you all heard, number of vaccinations have started to decline because I think we're reaching kind of those people who wanted vaccinated got the vaccine. And so now we're at the point where we need to literally start educating adults who, for whatever reason, don't want the vaccine. And now they're going to start vaccinating, you know, teenagers. And I think there could even be more resistance, not less. Of course, I do understand that every vaccinated person adds to the pool for the you know, for the general public health good. But again, there are these other issues that I mentioned. All right. So, and I know we have to come back to something from last time. Thank you, Kathy, for reminding. So regular early flu shot after having COVID-19 vaccine. Let's do that one first, because that's quick. My only recommendation is you don't do them within, say, 2 weeks apart. Give your immune system a couple of weeks to kind of in between. Other than that, a regular flu shot as usual. Interestingly, I have reviewed only one little study on what happened this past year with the flu. We had a massive drop in number of flu cases. I don't think it should be a surprise, right? Simply because we're wearing masks and we were washing our hands. What a surprise. But nonetheless, I think it's important to mention that if the social distancing precautions going to continue, we're probably going to have a lighter flu season next year. Well, this year, this fall and on. But so Kathy, if this is not answering your questions, just shut out, okay? That's my recommendation. Space them out. Not that it's actually relevant, since you already probably got vaccinated. You're not going to get flu until sometime in September, October, November, depending on production speed. Okay. Irene, you can always send me an email. I'll send you my email in a private chat. Are we near herd immunity? No, not at all. Everybody's talking about it. And I'm now hearing a lot of experts saying, forget the herd immunity. We're never going to get there. We should stop aiming for it. And you see, this is the point of confusion for me. This is why I'm like, okay, if we're vaccinating the kids to try to get the herd immunity, why are the leading experts in the country saying, forget the herd immunity, we're never going to get there? So for me, it's sort of like, if the goal is only just vaccinate as many possible people, get us close to the herd immunity, well, then communicate this clearly, because I'm not hearing that communication either. But, you know, even Fauci basically said, forget herd immunity, we're not getting there. Because we need to be at about 75 to 80% level to achieve it. We're lucky to get to 50%. That's what everybody's saying. You know, and that doesn't mean that that's irrelevant. It's still relevant. But within that specific question of herd immunity, no, we're not going to arrest pandemic completely looking for that. at least not according to the current projections, unless something changes. Maybe the attempt of CDC to say, look, we want to vaccinate everybody, including kids, is based on that logic. Again, even I think with that trajectory, we're not getting there because there's not that many 12 to 16-year-olds. And I think starting to vaccinate under 12 is going to be even trickier because they're going to have to make another study, and I'm assuming even less parents will agree to get such young kids vaccinated. So, all right. Cecile putting out a really good point. Total loosening of mask restrictions. Yeah, there's a little bit of yo-yoing. CDC seems like they're just kind of, I'm not exactly sure whether the restrictions loosening of restriction is that much of a problem, as much as this just the public, CDC is losing all the public's trust because they're yo-yoing from one decision to another. They making certain decisions and then they're not really explaining them very well. That makes a whole lot of sense. We talked about certain things that I think CDC did really well, like removing the restriction on vaccinated people outdoors and in the small groups indoors is reasonable. But it all seems to be that the way it's all done is based more on politics than on science, unfortunately. That's how I feel it. And maybe I'm wrong on that, but that's how I feel it. They certain restrictions to begin with were probably overkill, like everybody wearing masks outdoors, even when you're by yourself, never made any sense to me. But Pilar, I'm not sure the question refers to you. Are you asking about this to the new CDC recommendation on 12 to 16-year-old with the vaccine?
I was thinking about your comments about the conference.
Yeah, they did discuss the side effects of supplements, but they were it was very evidence-based, so they would look at evidence of the side effect of specific vitamin, and there are very few, so that's a good news in short. But yeah, it was a very specific and very organized presentation, but it's not really relevant for this meeting right now. Benita, I think we shot ourselves in the foot yesterday. What do you refer to? Just to the new CDC guideline? Is that what you mean?
Absolutely.
Yeah, okay, let me put this way. What I said is my personal opinion. So I don't know what the future will hold, and this is how I feel. And I feel this way. Actually, if I wouldn't be a parent, I may have felt different. Okay, but because I'm parent of two boys that both, well, the second one's gonna be in, what's today, 14th? In 4 weeks will be in both of them basically in that category. So they both are now qualified for the vaccine. So I'm speaking based on my personal feeling. I'm not even sure that my wife agrees with me. So you need to understand there's that.
If you read my further comment, I pointed out that yesterday when the news broke, I noticed a change. People who I know are only partially vaccinated are now walking around my office not wearing masks. This is really irritating. I'm one of the only people who is fully vaccinated.
Right. That's right. Right. Well, I mean, I think there's a lot of misunderstanding and miscommunication. And again, partially, I believe this is due to the kind of loss of trust in the CDC. But I'm also a little surprised that we're not hearing a lot from Biden's administration. I would expect a little bit more direct messaging. But maybe there's so much going on, of course, that maybe we're going to see this in upcoming days. It could all just be a little delayed, which wouldn't surprise me. Sorry, we're seemingly jumping back and forth to different topics. I hope everybody's okay with that. All right, let's take just maybe 1 or 2 more questions because I want to be mindful and we need to move on. What about kids building up immunity for colds? And well, that's exactly my point. Like, you know, that's what I'm doing. I'm building up my kids' immune system. They're outside, they take, you know, to me, that's more important, honestly. And nobody talks about it. Why? Because the vaccine is everything in US. So I don't like that necessarily, but that's what it is. Okay, do you recommend antibody testing for checking? Okay, so it's experimental. Apparently, I just talked to a head of the COVID response at GW, and Dr. Axelrod did tell me that there is a antibody test. We don't know if it's covered. It's currently mostly experimental, but it is available at LabCorp. I will need more time to figure that one out because I'm not quite clear as to why would we do it versus not do it. You know, not doing it, logic is simple. The efficacy is extremely high. If you get negative test, it doesn't mean it's not effective. And since we don't really know how this test performs yet, it's unclear whether you should be even considering it. So I think that it's just stay tuned. I think they're gonna work this a bit more. The problem is simple. In order for you to demonstrate efficacy of the test, you have to wait until enough patients get sick to confirm whether negative or positive test means anything. And so we may never get the result because we may never get enough sick patients who had the test to do this. So I have not seen the data or research on this topic. So, but it's a good question.
So doctor, in the meantime, is just having a symptoms and reaction to the vaccine enough to kind of prove that you have antibodies?
You don't need symptoms. No need to have symptoms. If you had a vaccine, you gotta assume if you had a Pfizer or Moderna, you assume that you're 100% protected against severe COVID or death, and you're somewhere in mid-90s protected against any COVID if you had 2 shots. So.
Okay, thank you.
Mm-hmm. All right, let's do last question. Have the vaccines shown to be a sterilizing vaccine? I'm not sure I'm following. Yeah, I don't know if Stay Well Man wants to unmute himself, but sterilizing.
So they're talking about having it affect your fertility.
No, I'm not. No, I'm referring to things like polio or measles, or these are sterilizing. Once you get the vaccine, then you can't contract the virus at all. Whereas, as far as I know, with these, you can still contract it. It's just reducing the chance of death. So if you don't, if they're not a sterilizing vaccine, then you can't. It's one of the 4 things required for getting
herd immunity. Yeah, so right, that's exactly right. So you're getting to the nitty-gritty of why some experts believe we'll never reach herd immunity. You're absolutely correct. This a non-blocking vaccine, so to speak. People can still get the virus and theoretically transmit it, although practically it hasn't been seen. And I'm guessing the reason for that is the inoculum needed to be transmitted has to be huge. We're just really not seeing that. But you're absolutely right. So there are lots of things that go into herd immunity, and unfortunately, I think it's unrealistic to expect it. So I think I'm going to stop here, just in respect for everybody's time. And if anybody, I know there's some questions left, but let's move on to our mind-body practice. And I'm assuming that our presenter was introduced, so I'm going to mute.
Yes, thank you. Pilar here.
Hi, Pilar.
Hello, everyone. You have seen me before. Today, I would like to share my screen to start off with a few. Let me see, where can I share my screen? Can I share my screen? I saw the share. Okay, here it is. Perfect. Can everybody see my screen? Excellent, thank you. So today, well, last time I was here, we were talking about breathing technique and pranayama. And today I wanted to go back to the basis, but to build a foundation. In many of my interactions on mindful leadership and tools for well-being, if the basic, the simple part of the breathing, understanding that is a very good foundation for meditation, for yoga, for all the practices on mind-body connection. So, hey, you probably have seen this before, the autonomic nervous system, what happens when, the sympathetic division of the autonomic nervous system prepares your body for stressful or emergency situations, and the parasympathetic division control body processes during ordinary situations. But I like to take the simple approach. Imagine that you are right now, you probably are at home, but if you step out to the street and you start interacting with people, and just to kind of see it visually how it happens, the back of your brain, your subconsciousness, has like zeros and one running through your back, and every one of those zeros and ones can be friend or foe. And your brain is interpreting everything constantly. And most of the time you're fine with things, but when you see something not consciously, the part at the back of your brain that is a foe could be a foe. Immediately, the first thing that happens is that there's a message to the body. And when you are not aware of how you react to things or what is happening in your body, suddenly you're experiencing sweating, or maybe your muscles are tense. And because you haven't reflected yet, there is a storyline. Usually people want a storyline for what is happening to their body. And it could have been a cloud that triggered this, a cloud that when you were a child, maybe a dog barked at you and you were scared, and there was certain thing in the environment that makes you recall this in your subconsciousness. And so what I'm trying to build here is what happens when our conscious mind creates storylines and get us into mental loops. And this is just one example of how it can happen. If you were at that time that something in your subconsciousness raised this fight reaction, and you had a new person in front of you, it could be that you think that the person in front of you is the one bringing you this nervous reaction, and you would say, well, I don't know what was about that person. And so let's talk about awareness and how to get there and how to calm our nervous system. I like this quote, yoga is the stealing of the fluctuations of the mind. So what we want to achieve is just a calm, like the water that you saw at the beginning that is so calm, and there's a drop, and then you see these waves of water. That's what happened in our brain, in our mind. So this is kind of what is to be mindful and have a mind full. And so that happens. You're trying, you get your head going, you get into mental loops, and you're not present. And with breathing technique, we just want to achieve, and with meditation, the ability to observe and be present. And the reason why is because this is the best way to be in the world, to be you, in connection with you, to achieve clarity, to resolve problems, to be creative, to name a few. And so going into breathing technique, I would like to say that the inhalation and exhalation and breath retention are usually all the same length when you're talking about the basic part of the beginning of your breath work. And this type of pranayama is good for people who use a mantra, which we are going to use today in the breathing exercises. Different phases of the breath are of different lengths. And the general rule in the practice is to let the exhalation be twice as long as the inhalation. But it is important to find an appropriate ratio for your own needs. Not too easy, that you are not doing work, and not too complicated, so that you can stay in the practice. You don't want it to be difficult. And for that reason, to find that out, what's my ratio? How do I need to breathe? How do I breathe? How is my body when I breathe? For that reason, we want to observe our breathing during our practice. So that's the first goal, and the goal for today is observation. So let's go to, we're going to do a simple meditation. And I say the simple meditation is the most complicated one, because to achieve that level or to get very comfortable with it, you need to practice a lot. But I'm going to walk you to several little steps that you can take to get there. So we're going to focus, we're going to breathe, and we're going to explore our inner being. So you are free to turn off the screen. You can sit down comfortably on the floor or on a chair where you can have both feet touching the floor. Your knees at a 90-degree, and the palm of your hands, if you are sitting on a chair, just over your thighs. If you're sitting on the floor, adopt the easy pose. The easy pose is basically crossing your legs and not exerting yourself, but trying to have the spine erect, the shoulders down, away from ears, and try to feel like you have a little thread coming out of through the crown of your head. So the nose is the portal, and the breath is the link between the body and the mind. And then now we're sitting down, and the first thing I want you to do is to place your right hand, or if you're left-handed, your left hand on your heart and your other hand on your belly, and then start just breathing in and out without exertion. You don't have to activate your breath. Just observe what kind of breath you have, and try to feel how your belly goes out and in and out. And try to calm your chest. If your chest is moving, you want your chest to be a little calmer. Just close your eyes if this is better for you. So we're going to remain there for a minute. Now you can open your eyes and relax. I want you to hold, take your hands up and put them next to your rib bones. And now your rib bones, you're going to, if you can see me here. So you sit down, and when you inhale, feel your rib bones going out. And exhale, and they are going to come in. And inhale. Exhale, always through the nose. Your lips are closed, are sealed, but very soft. And when you inhale, feel that inhale first into your ribs, the ribs expanding, and next into your belly. That's the next step of this breath that we're practicing. You inhale, ribs go out, and then the belly comes out a little bit. And when you exhale, the belly comes down, like closer to your spine first, and then your ribs relax. You practice that. Understand your body. Relax those shoulders away from your ears. On your next breath, you're going to do the same, but at some point when the belly is filled out, you're also going to fill your chest. So that's the last step. So we're going to do ribs, belly, chest. And you exhale again, try to do the belly first out, then your ribs, rib cage relaxes, and then your chest. Do a couple more. And relax, you can open your eyes. In the next 5 minutes, you're just going to breathe in and out in the same position you're in. If you want, you can place your hands looking up. If you're in a cross-leg position, you have the right palm up. You put the left palm on top and just let them rest. And you're breathing in and out. And this time, all your focus should be on the breath coming in and out of your nostrils. You could also, if you want, try to follow the breath all the way into your belly and out all the way through your nose. And I'm sure that, of course, you're going to have thoughts, right? So if a thought emerges, let it go. Another technique to let go of a thought is to name the thought. If I am worrying about work, I can say work and let it go. If I'm worrying about something about the past, identify this has a breath that I took already, it's gone. So let it go. At some point, you are going to be able to not have the need to say, I have to let it go, and constantly observe the breath in and out of your nose. I'm going to be silent for the next 5 minutes. Let's do 4 minutes, and you're just going to try to observe your breath and have no other thought. you can open your eyes and just take just a few normal breaths. If you want to make comments, you can make comments. In about 10 seconds, we're going to go to a few visualizations, breathing technique that Thich Nhat Hanh, one of my Zen masters, talked about and taught to people in the plant village in France a long time ago. So the first one that I would like to teach you is about finding your grounds if you have anxiety. And when we think about a mountain, we can think about a triangular shape, right? And the base is really strong and wide. When you do a speech, sometimes people tell you to spread your legs a little wider than your shoulders so you feel very firm and steady, and that allows you to speak better. So think about that mountain, and when you are going to breathe in, you're going to say, when I breathe in, I am a mountain. When I breathe out, mountain strong. And because the length of your breath may not be exactly the inhaling, when I breathe in, I am a mountain. If you say all of that, your breath in may not be all of that. You can shorten in mountain, out strong. In mountain, out strong. And visualize yourself being that steady, having that ground, spreading your roots down. And breathe in and out. We're going to do this for like a minute for you to practice. And then I'm going to let you time to take notes if you want to repeat this at some point. So let's start. When I breathe in, I am a mountain. Breathing out, mountain strong. When I breathe in, I am a mountain. When I breathe out, mountain strong. And continue for a few breaths. And you can open your eyes. That was mountain strong, that you can title mountain strong. And the next one we're going to do is water steady, water calm. So this one I've used a long time ago in leadership conference, a retreat I led. And you can use it also for communications. When you are in front of someone, if you are anxious or you have too many things in your mind, it's really hard for the other person to reflect on you, on yourself. You want to have a space for others to connect with you. And to create that space, usually when you are calm in your mind, calm in your ego, you create that space for the other person to communicate with you, to feel that connection. So that's also for calming yourself when you're alone, but use it as well if you have an interview, if you have to meet a new person, or maybe you get anxious about being in spaces with new people. And for this visualization, I want you to think about a lake and look at the scenery. There is a scenery, there are trees, beautiful trees, and there's a lot of wind. And so the water is moving. When the water is moving, the reflection of those trees, we barely can see, right? We see colors, we see some movement, but we don't see the trees. And if we calm those waters now, visualize this lake with very calm waters. It's like a mirror. Now you can see all the beauty of the trees, of the beauty of the sky in that water. So again, close your eyes. And you're going to breathe in and you're going to say, when I breathe in, I am water. When I breathe out, water still. I breathe in, I am like water. And I breathe out, water still. And you can shorten it, so I am water is the breath in, water still is the breath out. And visualize yourself just like water still. And you can open your eyes, breathe normally. And I hope you like these guided meditations and breathing technique. There is one more that you can practice on your own. We're not going to do it, but it's similar to the first one we did. When I breathe in, I am here. When I breathe out, here and now. That can put you to sleep. It's amazing, but if you practice this at night, when I breathe in, I'm here. When I breathe out, here and now. Or if you wake up in the middle of the night and you start having thoughts, you get in that mental loop, you can do that as well. Any questions? Happy to answer.
Irene, can I make a comment? I was born in Quito, Ecuador. I lived my first 8 years of my life. I don't know if I'm just fortunate to have those mental memories of such a beautiful place, but it's childhood. I find that when we return to memories that our childhood, they are very, very strong and very calming. I hope everyone had a nice childhood, obviously. But it's very, very calming to return to visualization of things you enjoyed as a child.
Wonderful.
I'm just so fortunate that I have those memories. Beautiful memories.
Thank you for sharing, Irene. Anyone else? Questions? How did it go? Did you relax? I think I let you all too relaxed that you have no
Sleepy. Yeah, that's a problem. After all these presentations, if you got the rest of your day ahead of you, you feel like just wanna, but that's good. That's those moments in the middle of busy days are critical. Just like what Dr. Frame said, we have to get up and move a little. Just the same way we have to pause. And so thank you very much. We'll see everybody next week. Actually, I won't be there because we have a large medical cannabis conference. And I think I will probably be wrapped up in that. But if I can, I'll join.
I'll be presenting, so I'll see you all next week.
The information that you learned.
Yep. We'll share with everybody. Bye.
Bye.
Bye, thank you.